If your mom just had surgery or your dad starting to forget things, or your aging parent is living alone and you are 3 states away, someone has probably mentioned concierge home care to you. But the truth is, most most people have no idea what concierge home care actually means. My name is Pierre Bourget. I am a registered nurse and the founder of Solux Health Solutions. Let's get into it. First, let's clear something up. Concierge home care is not just a regular home care with a fancy name and a higher price tag. That's what a lot of agencies are sell. That's what they're selling. They take their standard service, slap the word concierge on the brochures, charge more, and call it a day. That's not concierge. That's marketing. Real concierge home care is completely different model of care. Let me break it down of what makes it different in plain English. Now, different number one is concierge home care is built around the family's life, not just the agency's schedule. With standard home care, the agency sends whichever caregiver is available on a schedule that fits their staffing, not yours. A different person every few days, visits cut short because the next client is 20 minutes away. With concierge care, the schedule starts with the family. What does your mom's day actually look like? What does the need? What does she need help with in the morning routine, mealtime, evening medication, or overnight? We build the care around her, not the other way around. And difference number two, concierge home care is led by a nurse, not by a call center. Most agencies, when you call with a concern, you get someone else that's probably who doesn't know anything about your mom's, and they're not so sure how to answer the questions, and so forth. The true concierge home care, there's a nurse, an actual registered nurse who knows your family, who's reviewed the care plan, and who can reach directly. At Solux Self, the nurse is me. I am the founder, the nurse, who's involved in every client we take on. And difference number three, the caregivers, they train differently. In a standard agency, caregivers go through generic onboarding, bathing transfers, basic safety, and concierge home care. Caregivers train for a specific person they're serving. For example, if your loved one has dementia, the caregiver knows about dementia. If they are recovering from a hip replacement, the caregiver knows the post-op mobility. If they need companionship more than physical help, the caregiver match the personality, not just the availability. And it's not one size fits all. It's tailored. And difference number four, concierge home care is consistent. One of the biggest complaints that we have or we receive from families about traditional home care is the rotation. Different caregivers every week. Your mom has reintroduced herself, re-explain her routine, rebuild trust over and over. With concierge home care, consistency is the whole point. You get the same caregivers, they learn your loved one, they build relationships. Your mom isn't a client member, she's a person they actually know. And different number five, concierge home care is responsive. If something changes, a new medication, a sudden hospitalization, a behavior shift, concierge home care responds in hours, not days. There's no waiting on hold, no bouncing between departments. There is a direct line and someone who actually knows your situation who will pick up the phone. Now, let's talk about who Concierge Home Care is for, because it's not for everyone, and I will be honest about that. Concierge Home Care is for families who want more than minimum care. It's for adult children who can physically be there for the parents, and they really need to know that someone is capable of showing up. It's for seniors who value dignity, their privacy, and their dependence. And they don't want to feel like another case file. It's for families recovering from hospital, family who can afford family hospital stay, who can afford mistakes days after discharge. It's for people who can pay out of pocket, or who have long-term care insurance, and who want those who actually matches uh, what they're paying for. And how much does it cost? A common question I get: what does concierge home care cost? To be honest, it depends on the level and the hours, and whether it's hourly or 24 hours or leave-in. But here's what I'm going to tell you: concierge home care costs more than a standard hour to hour. That part is true. But there is what most people don't calculate. When you factor the cost of turnover, missed medication, preventable hospitalization, and emotional toll on the family, concierge often costs less in the long run. You're not paying for more hours, you're paying for better outcomes. Now, when it comes to insurance, it's another question that I get. Does insurance cover it? Medicare does not cover non medical home care, and that includes concierge home care. Long term care insurance does, depending on your policy. Most of the concierge client or private pay, they are using long term care insurance, and those insurance are usually purchased years ago, and they didn't realize that they could use their insurance this way. If you have long term care insurance policy and you never use it, call us today. We will help you figure out if it can cover concierge level care. So the bottom line is this: concierge home care isn't just a label, it's a model. It means a nurse led oversight, family centered scheduling, and consistent caregivers, specialized training, and a level of responsiveness most agencies aren't built to provide. If that's what your family needs, that's exactly what we built at Solux Health Solutions. That's what we in the business to do. For families across Indian River, St. Lucie, Martin County, and Palm Beach counties, from Vero to Boca Raton, we are in the business in providing high level, concierge level services to your loved one. Now, if this video helped you understand concierge level home care, hit subscribe. I'm posting twice a week on what families and nurses need to know, straight from someone who actually doing this work. If your family needs care, concierge level, and that they can rely on, please call Solux Health Solutions at 772-306-0233, or visit our website, soluxhealth.com. We'll take care of you, and we will make sure that the care is consistent, and again, we will make sure that you receive the best possible care. I'll see you on the next one. Take care.